Claire here, head trainer at Clarity Horsemanship. We know horses are prey animals, and that affects how they communicate. Prey animals tend to use subtle forms of communication so that only other members of their herd will understand them. That keeps predators from having an advantage in picking out who in the herd is not feeling well that day. However, it can make it hard for us to figure out when unwanted behavior in our horse is caused by pain and when it is caused by confusion in his training. Thankfully, some researchers studied many horses and came up with a solution to that problem. It's called the equine pain face. A pain face is the expression that someone or something's face makes when they are in pain. Human doctors got the idea first when working with patients who were too young or too injured to communicate verbally. They needed a way of figuring out how much pain an individual was in to help them develop an appropriate treatment and to be able to see if the treatment was working. Scientists in other fields recognized how useful this would be in veterinary medicine, and pain faces for various domestic animals began to be developed. The equine pain face was first published in 2015. Anyone interacting with horses should learn about the pain face. It helps you to understand how a horse is feeling, which should affect your behavior around it. Understanding this will help you know when to call the vet versus when to call the trainer. You'll know better how to care for your horse. While horses will sometimes communicate vocally with a whinny, nicker, or squeal, their preferred communication method is expressions. These are more subtle and harder for humans to decipher, but horses find expressions very easy to read. With practice, they can even read human expressions. Unfortunately, behavior that is caused by confusion in the training and behavior caused by pain very often look exactly the same. Determining if the horse is showing a pain face can help you determine what your solution to the behavior problem will be. Assessing the horse for pain before beginning a retraining program can also save you many hours of time and much risk of injury, both to yourself and the horse. Let's take a look at the researchers' findings on the equine pain face. The horse's whole face participates in expressions. Each part may participate more or less, helping to determine not just whether there is pain, but also the level of pain. This drawing shows the more severe signs. The rest of the horse's body participates too. His overall demeanor will be less interested in the environment, and he will move less or in unusual ways compared to a horse not experiencing pain. It is the combination of all of these factors, and not one factor alone, that constitutes a pain face. Let's start with the ears. The ears are lowered to the side, not moving around keeping track of the environment or showing interest. In extreme cases, they can be pulled down almost unnaturally far. However, a horse that is simply napping can also have its ears lopped over to the side. That is why a pain face requires presence of all or most of these symptoms, and not just one. The muscle above the eyes that can give a horse a worried expression if he is encountering something new or a bit scary become contracted in the pain face and stay that way. The eye itself gives a tense stare, not moving to look at things, but sort of staring fixedly. The facial muscles on the side of the face are clenched, pulling the horse's teeth together. You might see the jaw muscles bulged out and not moving. Horses in extreme pain may grind their teeth. The nostril, instead of being movable and almost six-shaped, gets a squarish corner at the bottom. The lips get clamped together, and lip or mouth movements are limited. What does this look like on a real horse? Let's practice. This is a 6-year-old mare I had the privilege of riding and training. Both photos were taken after a ride. Just prior to the photo on the left, she had been giving me a lot of trouble with turning, particularly in one direction. I saw her face afterwards while I was brushing her, took a photo, and recommended her owner call a chiropractor, which they did. The chiro mentioned that the horse's shoulders did not have the normal range of motion, which makes sense of the turning issues I was having during that training session. The second photo is about 2 weeks later, after the chiro's visit and some time off, as per her instructions. Just prior to the second photo, we had had a beautiful ride. Everything felt easy, and we made progress on the new skills I was teaching her. Notice how her face is now relaxed and normal again. If, based on the information here, you are beginning to suspect an unwanted behavior from your horse is related to pain, what should you do now? Well, that's already a great start. Now to figure out who will be most helpful to you. Think about the behavior. Does it come on when the horse wears a saddle? When you apply bit pressure? You might need a tack fitter or a dentist. Does it happen when you ask for a trot or canter? Think about calling a vet or farrier. Is it mild and appears to be muscular? A chiro or physio might be a good choice. Once you're on track to resolving the pain, retraining can begin for the unwanted behavior. Behavior originally caused by pain will not usually go away by itself. You will have some retraining to do until the horse realizes that the pain is gone. If, based on the pain face and description so far, you are not thinking your horse's behavior indicates pain, then beginning an evidence-based retraining program could be your next step. If the behavior is modified by training, you know you picked the right answer. If, however, the behavior persists or gets worse, pain is still an option and you might have to dig a bit deeper. That's all for today. Don't forget to subscribe so you don't miss more fascinating theory to help you understand horses better.